As you all know, the International Forum for Promoting Homeopathy is regularly conducting 3 sessions a day. That is from 7 to 8, we have our Hindi session. 8 to 9, we have the international session in English, and 9 to 10, local language session in Malayalam. Today, our guest is Professor Dr. Shital Shah, and she is the HOD, Department of Pharmacy, Ahmedabad Medical College, Homeopathic Medical College, and she has completed 29 years of clinical practice, and she has 25 years of teaching experience. As you know, she has completed MD in homeopathy, and PhD in homeopathy, then PG, IAH in difficult cases in awareness, Greece, and as a professor, she has recent teaching experience of 29 years and was HOD and professor in homeopathic pharmacy at the Homeopathic Medical College. And she is an examiner and paper secretary as well as homeopathy. Her remarkable 25 years of journey of hard work, passion, and contribution. And she had certificate of appreciation from Pearl University. She has presented so many presentation in this forum, as well as she has presented various papers nationally as well as internationally. She has written a lot of articles as well as a practitioner. She has completed 29 years and have more than 10,000 chronic patients in her kitty, and that is a great thing. And most of the cases are really incurable cases, and that is what is she has the experience, and the most of her cases were connected with PCOD, and she is now working in another clinic. Why acute homeo clinic? Acute homeo clinic tries to provide comprehensive and personal care with a focus on holistic healing. The clinic tailors treatments to individual needs, setting it part of other homeopathy clinic. She has emphasizing the patient-centered approach and dedicated the team at acute homeo clinic and committed to enhancing the overall well-being and promising long-term health. She is a health promoter as well as she is a mentor to many homeopathic doctors. This is what I have to say. A lot of things we need to say about Dr. Shital Shah, but I'm concluding here because she is waiting for a very wonderful presentation in this evening. As you know, the topic of the day is application of Ken observation in clinical practice. As you know, Ken observation, knowing Ken observation will definitely give you the right direction of cure, and this is what we are all expecting from Dr. Shital Shah. We welcome proudly, Madam, to this event.
Thank you, sir. Thank you. Thank you. Shall I share my screen?
Yes.
Can you see now?
The first page is application of Ken observation in clinical practice.
Yes, yes.
Just open lecture 1, followed by lecture 1.
Okay, shall I start?
Yes, yes.
Good evening, all the students. Today, I would like to share a very important topic in our practice. The two things is very important in a Mahabharata. I start with the god Krishna and Arjun. If in a Mahabharata, if Krishna Bhagwan alone is there and there is no Arjun, then there will be a no victory. And if there was an Arjuna and no Krishna Bhagwan, then also there will be a no victory. So here, I would like to explain, and I would like to start with the thing that if we have a very good knowledge of a materia medica. We have very good knowledge of application of a materia medica. But if we don't have the knowledge and application of an organon, then also we could not be a successful homeopathy. In homeopathy, we don't have any sonography reports. When the case come, we do the case taking. After doing the case taking, with our knowledge of materia medica, we search one medicine and we prescribe it to patient. But if you have a very good knowledge of organon, and if we can apply the knowledge of organon along with the prescribed remedy, you can see the pathway, the tracking ID of your medicine. You can say that this medicine, after 1 month, with certain observations, with certain means the certain things which has been given by the patient, you can say that look, you have such type of the prognosis. You can reach in a 6 months, in a 7 months, in a 1 year. So observation, cant observation is very, very important in each and every chronic case when the patient comes and we have to utilize it. Now what happens? Hahnemann sir has explained us the vital force, the immunity power, the resistant power. During COVID time, we realized that what is immunity power. Here, I would like to just give an example that in our everyday life, if your immunity power, if your vital force is strong enough, it is in a good strength, no compromise has been done on the vital force, the disease could not enter and the disease could not deteriorate the organs. So first, the normal vital force, normal immunity power never produce any symptoms, and that immunity power fights with the disease and they say that no, I want to keep my organs safe. But as soon as the resistant power, the vital force goes from its normal position, the disease enters in our body. The bacteria, the virus, each and everything enters in our body, and now the immunity power could not fight and it's throwing the symptoms. So, but the homeopaths prescribe medicines and uplift or restore the deranged vital force to its normal position, and that's why we get cure in homeopathy. So our science believes without derangement of the vital force, a disease could not enter in your body. To start the disease, vital force derangement is necessary. Hahnemann sir has given definitions about the disease. We should not start our practice that, oh, see, today I had one case and the patient has asked me that do you treat colloidal detachment or do you treat the retina detachment? I said, we don't prescribe a medicine on that. We should see the patient. We should take a case and we have to search certain PQRS in our patient. And if even in such a difficult case, we find a PQRS which matches our materia medica, we can take a chance.
Madam, the first page, it is stuck on the first page itself. Application of kind of observation, the file is not at open. All the other things are just before, soon after that, we can see lecture to one, then a biography of Hahnemann.
See,
So,
you can see the speak or I share again.
yes, you need to share again because the application of kind observation in clinical practice is there, but that file is not at open.
Okay, so I'm sending again.
Yes. Now the materia medica organ on the picture has come out.
Can you see this?
Yes, yes, a person free of disease symptom equals a good immunity power.
Okay, shall I continue?
Yes, now you can
Yes.
continue, madam.
Yes. So immunity power is very important in a homeopathic science. Now, I've started with this that, see, Hahnemann sir has described acute disease, chronic disease, and acute exuberant of a chronic disease. I'm not an organic teacher, but I'm just explaining you that any exciting causes which deranges from outside, if the excitement, take a pani puri, which that touches outside to the vital force and it deranges. Second, the disease which have starting point and ending point. Suppose COVID, measles, whooping cough, all are the diseases which have a fixed starting point and ending point, that all the diseases are known as an acute disease. But in a homeopathic science, Dr. Hahnemann sir has explained very nicely about the chronic disease. And the chronic disease, in that he had explained different miasms, which touching to our vital force, which means deranging the vital force and it producing a disease. So what is symptoms? Our symptoms means a language of a deranged vital force. If vital force is in a good condition, no symptom will appear and no disease symptom or any symptom will appear. The patient is healthy, the person is healthy, so no symptoms are there. Suppose a person comes and says, uh, like a near one, that there is a death of a near one. He cried a lot for a 1 week, and after that he says, suddenly I start too much pain in my head. Even though I take too many medicines, I've started to go from one person to another person, but my headache is not going on. It's last 6 months that my headache is not going on. So it's a sign, it's a symptom, it's a sign that your vital force is deranged and the vital force need a help. He had tried that he, by itself, he can, the vital force can restore and it comes to its normal position. But when the vital force need a help, then he throws symptoms. So symptoms is very, very important in a homeopathic science. Now what he thrown? He thrown grief, death of a dear one. That was the causative factor. And what he thrown? He had thrown the vital force had started with the symptom headache. So what we do in approving? In approving, the Hahnemann sir has selected a person and that has been known as a prover. Now we have given a drug to the prover, the potentized drug to the prover, and after the proving has been started, he had thrown certain set of the symptoms. That certain set of the symptoms has been written in a materia medica. So Dr. Hahnemann sir has not allowed us to know the name of the diseases. We should not prescribe on the nosological name of the disease, but we should prescribe our medicine on the symptoms. So symptoms are the language of the deranged vital force. And for the successful homeopathic practice, we should understand the symptoms which correlate with the proving symptoms. Now, I've just given an example that if you are in a right direction, see, a boy means what is homeopathic aggravation? A boy is playing and trying to keep the ball into the basket. He is trying in a right direction, but he need a little push because he could not do by its alone. He tries, but he could not do it. A homeopath comes and prescribes a medicine which runs in the same pathway, same proving symptoms, and with the little help, the boy is successful and the ball goes to the basket. So that is why each and every the cure process have aggravation. Aggravation, another example for an aggravation. When we sit in a train, we are relaxed, but when the two compartments are joining, there is a slight jerk, and that is a sign that now the train is started. So homeopathic aggravation, according to Dr. Kant, that if after prescribing your medicine, aggravation starts, that means you are on a right track, you are on a cure process, and the progress is good in such type of the cases. The very important thing is direction of a cure. To understand the direction of a cure, first we should understand the layer of our body. A person is having three layers. One is physical layer, emotional layer, and mental layer. A disease can enter from any part, from the mental plane, from the physical plane, and from the emotional plane. So same way, we can say that the cure is taken place by understanding only that the patient is having no complaint. It is totally free on the physical plane, emotional plane, as well as mental plane. Haring law of cure has been given certain direction to understand that prognosis of your cases. Cure proceeds from above downwards. See, above downwards means from head to foot. If a patient is suffering from an eczema and you have started the treatment, and from face the eczema goes to the torso, then you are in a right direction. So the cure proceeds from above downwards. Second is within outwards. Within outwards means a patient is suffering from a mental disease. After your treatment, now that mental disease has been reduced and the patient has started the disease on the emotional plane, then emotional plane has been reduced and now the patient has been started the disease on the physical plane. So the from the inner layer to the outer layer, that shows that you are on a right direction. And second is most important organs to the least important organs, and in the reverse order of appearance of the symptoms. Reverse order of appearance of the symptoms suggest that the patient, see, the sphere of action which has been given in the Materia Medica had explained certain proving symptoms, certain system which has been affected. Natremure will produce depression, simple depression, but aurum mat will produce major depression. So the disease lachesis will always produce hypertension. So sphere of action has been given during the proving process in the Materia Medica. So reverse order of appearance of the symptoms in a childhood, tonsillitis, and today hypertension. So reverse appearance of the symptoms in your practice that suggests that you are on a right direction. Certain plane. See, here I have explained you that there are three plane: physical, emotional, and the mental plane. Now, when you are treating a person who is suffering from a skin disease, with your treatment, the patient comes and says, "Oh, doctor, you are very good. My all the skin eruptions has been vanished. Now I don't have any eruption on my body. I had eczema from last 5 years, and today I don't have any eczema. But I started little bit of an anxiety. Sometimes I feel anxiety that was not there previous." So you have treated the patient on a wrong direction. You have shifted the skin diseases into wrong direction, shifted the skin disease on the emotional plane. Or suppose a patient is suffering from a heart disease, and after your treatment, he say that my heart symptoms has been reduced, but I have my severe pain in my bones. I had severe pain in my bones, stiffness in my bones. I could not walk. So that is a right direction, because you have started the treatment with the heart disease, and now the heart was the main organ, and the disease shifted from the main organ to the lesser organ, that is bones. So Haring's law we should apply for the successful homeopathic medicines. To understand the Kant observation, there is one criteria which we are applying. For the understanding for the students, I have applied the immunity power into 4 compartments. If the person, means how we can know that the person's immunity power is too good. From starting, I am saying that we should have a good immunity power. And if immunity power is good, the person will not start the disease. But what is immunity power? how we can judge that the patient is having a good immunity power and this patient is not having a very good immunity power? So the simple rule is that, so we have divided four part the immunity patients. In a class 1, there will be a very good immunity power. Class 1 onwards means class 2, class 3, class 4. Such when we are going down, the immunity power is reducing. To know in a patient that they have a very good immunity power, when we do a case taking, in a case taking, in a whole case, after taking a case, the person says the same symptoms which has been written in a materia medica. Example, a patient is very restless. He could not sit in a one position. Feels very chilly. He is having one covering. You feel hot, but the patient wants two covering. He take a glass of a water and he just drink little bit quantity just to wet the lips. Keep aside. So see, the patient is showing all the arsenic album symptoms. That means that patient's immunity power shows us a right direction, the right pathway in which direction the sorry, the vital force need a help. We homeopaths just help the deranged vital force to restore to its normal position. We are not removing the disease directly. We are not touching the directly to the disease, but we are uplifting the deranged vital force, and then that vital force fights with the disease force, and we say that the patient is cured. So when the patient gives you the same symptoms, a clear-cut pathway, then we can say that this patient immunity power is too good and this patient belongs to class 1. Even though the cancer patient, if he belongs to the class 1, he will throw the clear picture of the materia medica. So not cancer means low immunity and simple coryza that means means high immunity. No. When we take a simple case of a coryza and you could not find out any indicated medicine which belongs to our materia medica, then that case, even for the coryza, that case also we suggest that this person's immunity power is too low. So we have to remember that if there is a clear-cut case, clear-cut symptoms which has been written in a materia medica, then the person belongs to the upper level, that means class 1 and a class 2. As the patient goes to the class 3 and class 4, the clear cut will become muddier. You cannot see in the morning when there is a fog, you cannot see the perfect picture. How is the sun? We just assume because every day that maybe today the sun is like this, maybe the birds has been gone like this, but it will be maybe. We are not sure enough because the picture is very muddier. So as the immunity power goes down, the immunity power, the vital force could not show you the pathway. They have been frustrated. They have been means the immunity power has been deranged in a such a way that they don't have a capacity to throw the symptoms. And that's why the homeopaths find difficult to search indicated medicine from the materia medica. So hope you have understood that clear pattern of the symptoms which been connected with the materia medica, with the proving symptoms. So clear cut pattern of the symptoms which connect with the proving symptoms. That means the immunity power is too strong. But the suppose a person comes and says, I had a severe headache. Oh, I have a too much headache. Doctor, please help me. Doctor, please help me. Then we should not say that take a belladonna. Come on, give us some symptoms. He said, no, I had just headache. Then we could not find out a medicine, even in a simple headache. So vital force has to show us a clear pathway. And that clear pathway means immunity power is good and immunity power is low. So after taking a case with the totality of the symptoms and with the help of the reportization sheet, we have selected one medicine. See, to select one medicine and to give a medicine to a patient, that whole journey is very task oriented for a homeopath. It's not easy to search one medicine from the whole 2000 medicines. We are giving our level best. We are taking case, we are searching, and we are prescribing one medicine to a patient. So now that medicine is very important. Mostly the beginner homeopaths, even they choose a right medicine, but because they don't observe the pathway that their medicine is right or wrong. When the patient comes and says, your medicine is not working, they just go to the panic because they don't have the confidence. They don't have trust to that medicines. So they start panicking and they just change the medicines and throws the medicines from one medicine to the other medicine, another medicine, another medicine. And now the curable case is converting into incurable case by a homeopath, because by throwing too many medicines without understanding, that converts the case into muddier. So here I would like to help the beginner students or the beginner practitioner that once you prescribe your medicine, keep trust on your medicine and then search with the help of the Kant observation that your medicine is on a right track or a wrong track. So first observation is don't repeat a dose. There are certain criterias that when the patient comes and says, don't repeat a dose, wait and watch policy should be observed in such type of the observation. The first observation is clear initial aggravation of the main, I could not see. Okay, fine. So clear initial aggravation of the main physical symptoms on the mental plane and on the emotional plane, followed by a quick, long-lasting recovery. See, this observation is an observation that you will love a lot. If the patient comes and says, I will show you one example, that a 25-year female suffering from heaviness in the stomach, aggravated after eating, could not digest fatty food, sour belching, sour stomach, bloatedness, and can't digest milk. Milk produce undigested diarrhea. Studied engineering and had a lot of outdoor food as she stayed in a hostel. Sensitive, emotional in nature. Sun produce headache. Slight noise, music aggravate her. Sometimes when the patient throws the symptoms, we say, oh, he's saying about this medicine only, this medicine only. So clear-cut picture, then and then only you can have such type of an observation that as you prescribe a medicine, and there will be a, see, I've shown here that after prescribing natrum carb, the patient has aggravation of all the symptoms, all the main symptoms. See, homeopathic aggravation means aggravation of the main symptoms. The patient has aggravation in the sour belching, aggravation in the bloatedness, aggravation in the diarrhea, aggravation in the sour belching, indigestion of the milk. So this was the reaction. This was the reaction, aggravation. Now, aggravation not only on the physical plane, but aggravation on the emotional plane as well as on the mental plane. The patient says that after your medicine, I weep a lot. I had too much weeping. In any condition, I just weep. And after the medicine, doctor, I sleep a lot. I had a very good sleep. I slept 2 days, 3 days, 5 days. So I slept a lot. So the such type of the reaction, if the patient comes and says, then please never repeat a dose. Wait and watch for a long period of a time. I've used the word long period of a time means sometimes you don't want to prescribe a medicine for a 1 year. for 2 years, for 3 years. Just relax and give a dose and wait, 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 and wait. So such type of the observation is considered as a cure in a homeopathic science, aggravation in the main complaints, followed by amelioration on all the three levels: physical, emotional, and mental plane. The second observation, indicated remedy produced aggravation on all the three levels, followed by amelioration, but new symptoms appear belonging to the proving symptoms. See what happens. We have got such a nice observation that there was an aggravation followed by amelioration. Such a nice we have observation, and after a few days, the patient comes and says some of the proving symptoms. Now, if we don't understand that what is going on, if we don't know, if we don't apply the observations which has been given in account, then a homeopath does a biggest mistake. And with the repetition of a call of a patient, they just give a dose of a medicine. Sometimes they give a higher potency of the same medicine, or even they repeat the same medicine. But in both the way, they will spoil the case. Even sometimes we feel that I should give one dose more and I should eradicate the proving symptoms. That is the biggest mistake which has been done by the homeopath. Again, I'm trying to explain with a case that a male patient who was 40 years old suffering from allergic rhinitis, that means sneezing, congested head, watery discharge from the nose with irritability. Now, see, here the patient is throwing the clear picture of the disease symptoms as well as the clear picture of the materia medica. So, if this suggests that the immunity power is good, the vital force is good, still if you find a right remedy in a right time, then the chances for the cure is very, very much. The prognosis is very good. After all these symptoms, I had prescribed Legacy Stanum to the patient, and the observation was, so see, here I have told you that the sneezing, congested head, watery discharge from the nose, and the patient comes and says, Doctor, do you believe as soon as my sneezing starts, I feel like I am in a heaven. The discharge which comes, I feel like I'm in a heaven, which helps me a lot. So every time he sneezes, he feels like he is in a heaven. The sneezing makes him better. So this was a strong PQRS of a lachesis, and that's why we have prescribed a medicine to the patient lachesis. And this was an observation. After the medicine, the patient has started two proving symptoms. One is congestive pain, as if there is a rush of blood in the head. And second is the extremities has been started to cold. The extremities is cold. Now, even the patient wants, we should not prescribe a medicine. Here we should prescribe a placebo to the patient, and we should wait for a certain period of a time. The third observation is initial aggravation of the main complaint, followed by general improvement on all the level, but some minor symptoms remain, which is very, very common. When the patient comes to us and after our single dose, there is an aggravation, and after the aggravation, the patient feels better. Now, he had disease from so many years, and after your medicine, when he feels very, very good, then he feels happy. So now he will call you that, please, doctor, add one symptom, please prescribe another dose and just eradicate my all the symptoms. I want to be free. I want to be free. There should not be a any symptom in my body. So please, you have cured me 90%. Just 10% is remaining. Please give a high dose, whatever the medicine you have prescribed. And with the force of the patient, If we have prescribed arsenic 1 mg, we are forced to prescribe arsenic album 10 mg. Or if we have prescribed 10 mg, we are forced to prescribe 50 mg. Now, again, this is a biggest mistake in a practice when there is an aggravation followed by amelioration. That means the vital force have a capacity to fight. The vital force is in a good condition. Then and then only such type of the observation we can observe in a patient. So the remaining 10%, we just want to give and explain to the patient that please don't be in a panic. The remaining 10% symptoms will definitely go away. If I prescribe a medicine early, then maybe the remaining 10% will not go and the case will go to the reverse and you will start again the disease for the 50% for the more than 30-20%. So such type of the reaction, never prescribe a medicine. Okay, so here also I have explained a case that there was a recurrent coryza, cough, redness in the eye, pain in the throat, fever, aggravated by change of weather and after eating or drinking cold things, very impulsive nature, salivation and offensive mouth, marked desire for the brain. So see, you are getting the clear picture of the materia medica and we have prescribed a Merxol and such type of the reaction. So the minor symptoms means all the symptoms has been gone by the aggravation and amelioration, but just the pain in the throat has remained. So the patient means calls and says, all the symptoms has been vanished. Please repeat a dose and remove my pain in the throat. No, we will not prescribe a medicine. Sometimes you can give just plain paracetamol, but don't prescribe any homeopathic medication and disturb the reaction of a Merxol. Allow the Merxol to uplift, to restore the vital force to its normal position. Homeopathic science is a journey. Homeopathic treatment is like a journey. We could not reach very fast. So we should always explain to the patient that look, after prescribing a medicine, we will judge our vital force, and by judging our vital force, we can reach to the destination. Initial aggravation followed by amelioration on all the level, but after 1 month, there are partial relapse. Now, the whole disease is not coming back, but the part of the disease comes back. Part of the disease means part of the disease symptoms comes back. Take an example that a 30-year-old male working in a bank as a manager and stays alone in Ahmedabad, habit of outdoor food and fond of a junk food. From last few days, having pain in an abdomen, sour irritation, heartburn, bloating, heaviness and fullness, especially after eating, constipation, bread, disagree, don't like to eat food from tiffin, desire hot food, and he is dictatorial and short temper. On the basis of this, we have prescribed lycopodium. This is the picture. Such type of the symptoms are there, and this is emotional play. Now, after prescribing, see, before that, on this last line, there is an aggravation from bread, desire for a hot food. On this basis, see, on this 2 PQRS, because all are the symptoms of the fatty liver. The patient is suffering from the fatty liver. So Hahnemann sir has not told us that we should prescribe on a name of a disease. Nosological prescription is not there. So we have removed this, all this, but we have prescribed lycopodium on the basis of the sphere of action, that is fatty liver. Second is aggravation from the bread and desire for a hot food. So this is so when the patient comes and says, that means again that after your medicine, there was an aggravation of my main complaints. All the fatty liver symptoms has been increased, but followed by the amelioration. But doctor, I feel again my disease is coming back. The whole fatty liver symptoms are coming back. Then what we should do? Whether we should prescribe lycopodium 1 mg again or what should we do? I'm explaining you with the full relapse. Same patient, previously half symptoms has been came, and then in a fifth observation, the whole disease comes back after 1 month. Then what should a homeopath do? A homeopath should observe that along with the full relapse, again along with the partial relapse, the keynotes on which I have prescribed a lycopodium is also coming back. Which are the two keynotes? Aggravation from a braid and desire for a hot food. If the whole disease come back and the patient says, doctor, now I can eat bread, I don't have any problem. After your medicine, the whole disease is coming back, but I can eat bread. I don't know, but now I can take a tiffin. So that means the whole disease came back. There is a partial relapse of the disease, but the patient is not want lycopodium again. We have to do a recase taking and try to search that another medicine, same another PQRS is coming back or not. If the disease has been started, the whole symptoms of a disease has been started again, but there is no PQRS, you could not search a medicine, then also you should not prescribe a medicine. You should wait for some period of a time. Next observation is initial aggravation followed by amelioration only on the physical symptoms, but no change in a mental level and the emotional level. See, I have told you that there are 3 layers. So from the mental layer, the vital force always try to maintain the disease on the physical level. He will don't try that the disease starts on a mental plane or the disease start on the emotional plane. Always first the physical part or the external body will start a disease, and if the patient could not understand and deranges the vital force too much, then and then only the disease starts on the emotional plane as well as on the mental plane. So not having affection on the mental level and emotional level, but the disease always remains on the physical plane, that suggests that still the vital force in a good position, and the vital force is in a the prognosis of the disease is still there. There are chances that we have a good results. Here I have tried that the patient having an emotional disturbance every day, with an explanation that a 30-year female having the symptoms of a bloatedness, and after the marriage, the mother-in-law is very dictatorial. There is a continuously emotional trauma on her. But so she is not producing a disease on the emotional plane, but she starts the disease on the physical plane. So everyday emotional disturbances and the physical plane has been affected, and she starts a disease on the physical plane. So in such a reaction, we should not prescribe a medicine, but we should do wait and watch. Wait and watch is like a guru mantra in a homeopathic science. A shy patient who says that nothing has changed. See, sometimes it happens that after we have done lots of work, we have searched on the materia medica, we have searched in the repertory, and we have prescribed a medicine. And the patient after a 1 month comes and says, doctor, you have prescribed a medicine and I don't feel any change in my body. I just feel same. So never believe that. Okay, you ask each and every question. Okay, the headache is same? Yes. So see, the tone. Previously, he says, I have a severe headache. Now you have asked, he has to memorize that I had a same pain or not. So that is suggest that the improvement has been started. So never prescribe a dose. So a shy patient who says that nothing has changed, or when the patient comes and says that there is nothing has been changed, Don't believe them. Ask each and every symptom. Just notice the observation, and you can see a little change in the tone, the intensification. Previously, I had one patient. She has done CA. After completing her CA, she started migraine. So continuous study had started a headache. I had prescribed Calcarea Phos 1 m. Now, previously, she was always having 3 episodes in a 1 month. Now she had same intensification, same thing, but 1.5 episode. So the episodes has been reduced, but the intensification are the same. So if the person comes and says, Doctor, after your medicine, I still have a migraine. So that is no, don't prescribe a medicine. The medicine is acting. We are on a right track. Never be hurry to prescribe or to repeat a dose that is in a homeopathy. Now, this was the observation that after your medicine, you have to judge, and if your medicine is correct, the all the observations which I have told you that you will observe in your patient. But you have prescribed incorrect remedy. If you have prescribed a partial remedy, see, partial remedy, incorrect remedy always confuses a case. How it confuses a case? The proving. See, each and every student knows the dumb charade game. Vital Force tries by playing the dumb charades game, throwing the symptoms, and ask her that understand which medicine I need. So we try to understand it and we throw one name of the movie. But Vital Force says, no, you are nearer, but it is not a name of a movie. So partial remedy always produce more confusion, and it is dangerous in a homeopathic science like steroids. It will vanish the symptoms which has been thrown by the vital force. And if repeatedly partial remedy has been prescribed to the patient, then one day the clear pattern or the clear picture of a medicine will be not there. And even we have a very good knowledge of a materia medica, we could not help to the patient because there will be no clarity of one medicine. So what happens if we prescribe a partial remedy or incorrect remedy? See, when the organism is strong enough, there will be always initial aggravation on all the levels followed by amelioration. But the amelioration starts without this ideal reaction, then the indicated remedy is either incorrect or partial similar. A homeopath should do re-case taking and search a remedy which help to produce a ideal reaction. Never repeat the same medicine in different potency and waste the time. Because if there is an incorrect remedy, partial remedy prescription, the whole after after prescribing your medicine, the patient is not feeling better on all the three levels that suggest that our medicine is wrong or partial selection of the remedy. No aggravation, amelioration for a few days, then a full case comes back. Now, see, it happens. Nowadays, we know that there is a grief, emotional grief in each and every person. So we just simply give Ignatia, Natramure, such type of the emotional medicine. So that medicine has touched only the grief part, not the whole disease. So the patient says, I feel better for the 10-15 days, and then the whole disease comes back. So that indicates that your medicine was incorrect or your medicine was partial. No change in the case. The patient belongs, see, the remedy was not properly potentized. You should always see when the patient comes and says that after your prescribing medicine, there is no change. Don't immediately keep a doubt on your medicine. Trust your medicine and see that the company just change the company. Sometimes the medicine has been not properly potentized, so it has been spoiled. So we have to borrow from another pharmacy, and we should prescribe the same medicine to the patient. And the another thing is we have prescribed with the same keynotes a polycrest remedy, which is very common. We prescribed the phosphorus, but the patient wants bismuth. So see, bismuth and the phosphorus, they have a similar keynotes. So, but slight difference. So we could not that understand the slight difference, and we just prescribed phosphorus. So phosphorus will not cure, just remove the symptoms partially for a few days, and again the whole disease comes back.
Madam, how many slides more?
4, 5. I'm going fast.
No need of going fast. I think we can have another session on the same. And
If any questions are there,
yes,
then
only 5 minutes remaining.
okay. If any questions are there,
Yes, so people want to communicate to you. with
yes.
you. So that from observation 4 onwards, we can go ahead in another session, the same subject. I mean,
Okay. But
as per
any
the-
questions? Any questions are
yes,
there?
yes, definitely, Madam Dr. SHITAL SHAH. It's really a very good session, and I open up to all homeopathic doctors how to move forward when you took the case in details and administer a remedy. And then usually people may believe that when you apply a homeopathic remedy, it may get aggravation, but the aggravation does not mean that it will long-lasting aggravation, but it is only for a few minutes or few hours or sometimes a few days. And
Yes.
thereafter, the patient will
So
gradually.
maximum homeopaths fails because they are not applying the knowledge of Kant material. This means Kant
Yes.
observations.
That's why some people used to come over to our clinic and used to ask the doctor. Usually, people say that once you take homeopathic medicine, there will be the curse will be worsened in the beginning, and then only then it will relieve. Is it so? Then how can I treat the skin condition, doctor? It is already I am having pain and severe infection. How will you manage the case, doctor? Like this.
So, if you allow, I had one nice answer from the organ book that take an example. If the patient is having hypertension, means it's more, and it's
Yes,
around
we-
250, but homeopathic medicines will not increase that much hypertension, and there will be a death of a patient. But
Exactly.
the patient will start severe diarrhea, or the patient will start with an means 20-25 times diarrhea. So that is also suggested as an initial aggravation followed by amelioration.
Exactly.
Yes, it
Exactly.
will.
But people believe that the same condition will get worse. This is the point of to be noted. That is the greatest point that you have suggested, because when a patient